Now you're welcome to Frontline. This is a segment that we dedicate entirely to celebrate our frontline workers, health workers, security workers. They are the people who are putting their lives on the line to ensure that you and I are protected. Today, I'll be speaking with Dr. Aramansa Bano Forjoe. She is the National Secretary of the Society of Private Medical and Dental Practitioners, Ghana. These are doctors working within the private sector. Dr. Aramansa is also CEO of Bano Memorial Hospital in Latebiokoshi, Accra. Let's hear from you. What are your thoughts? Do you have any questions related to the health sector that, you know, we can get some answers from Dr. Bano? Send it to WhatsApp line 0540109009. That's 0540109009. I'll talk to Dr. Bano right now, but I'll be waiting for your questions, so I send it through before we end the conversation. Thank you so much, Doc. Hello, Doc. Can you hear me?
Thank you.
Very well.
Yes, I can hear you. Thank you.
Right. So I usually here on Frontline, when I start, I like to get personal with the health officials that I speak to. So share for us your personal experience as far as COVID-19 is concerned. How has life changed?
Oh, it's very difficult. Have a situation here where you are patient, not sure whether it's carrying a there are all sorts of presentations this afternoon, and she said a couple of cases they are presenting heart failure. And that, I mean, sometimes is unnerving. Main problem is the lack of PPE. And it looks like it cuts across the entire country. Colleagues in the polyclinics are complaining about PPE. And so we find
Doc, it's very difficult for me to hear you, and I believe my viewers aren't able to hear you as well, but we're really interested in this story and we want to hear you. So let's try and call you on the telephone line right now, even as we connect you once again. And whilst we connect, Doc, I'm going to read for you some of your messages. We really want to hear that story, so let's smoothen up the line right there. So some of you are still sending your messages, although some have to do with learning at home. Most of them actually have to do generally with COVID-19 and our efforts in stopping the spread here in Ghana. Let's see what the messages are. Do not call this line. You disrupt the flow of the text of the WhatsApp messages, and I will just share this, whatever it is you send to me, with the rest of the world. This is coming from Cape Coast. He says, this is totally unacceptable. My first time of seeing Ghana posting nurses without allied health professionals. This is very bad, and we call on the President and Minister of Health to address our issue. Our names were forwarded to the Ministry of Finance with the nurses. We are just a few professionals, but they have decided to post them, leaving us behind. So you're saying that you must be an allied professional. You're saying that you have been left behind. I'm not sure how to address this, but certainly we'll get some answers subsequently. He says we have sacrificed to do contact tracing, and yet the health ministry has decided it's not treating us well. Wisdom sent that from Cape Coast. Wisdom, thanks for sending in your message. This one says, I am a junior doctor. I'm a junior medical doctor. I don't know why medical officers, more than 500, are still at home and haven't gotten financial clearance to assist in the fight against the pandemic. These medical officers are all qualified and currently doing locums at these same health facilities, managing the suspected and confirmed cases. President address consistently skips the financial clearance of these medical officers. So this is an issue. You say you are a junior doctor. You say about 500 of you are still at home. You have not had the financial clearance. We hope that the Ministry of Health is listening, is watching, and they've heard and will certainly follow up. You can send us more details, perhaps your number. We can talk to you, maybe Skype with you, and then we'll be able to amplify that concern and get some responses to it as and when there is. This one says, this morning they told us 566 and this afternoon 636. Yes, because every now and then authorities are monitoring the cases, authorities are monitoring how it's growing, whether it's going down, and they are doing so they can bring you the updates. So that's the latest updates we're getting right now. You say, do they have the numbers there? Do they have the numbers there and giving it to us small? Anyway, for as much as 17 persons who have recovered, we hope for the best. But Gifty, I'm sure recovered figure 17 of today is authentic. Unlike they came to tell us 31 persons have recovered, bringing the numbers to 33, and later we heard them saying 4. So they clarified, they provided some clarification, and in that clarification they indicated that 33 people had tested negative, but it is possible for them to be reinfected, or it's possible for them to test positive again. So they had to redo the test again, just to be sure, to do the test again, I should say, just to be sure that we're not giving ourselves a false sense of hope as far as the recoveries are concerned. So I hope that answers your question. Someone is asking how many cases are so far at the moment. We just did that 636. 636, that's the latest number there. We're also trying to raise Dr. Bano again, so we'll do that conversation. Well, let's go on the line now. She's there with us. Doc, thank you. Like I said, we're really interested in the story, and so we wouldn't allow the smoothness of the line to jeopardize that. You were telling us how life has changed since COVID-19 for persons like you.
We have patients walking in from all walks of life,
right?
And you don't know who's walking in. We have a protocol for detecting who is highly likely to be a COVID case and who's not. But we know that some patients are turning up and they are asymptomatic. So that tends to be very, very problematic, because you've got to be extremely careful.
Yeah.
So you've got to take into consideration all your frontliners, your nurses, your lab technicians, even the people who are working within our offices have to be protected. So right now we have a high demand on our PPEs, and we have to have enough water to have people wash their hands as they are entering, for our nurses to wash their hands even more than they were before. We're having to provide sanitizers, so people coming in are using sanitizers. They're using sanitizers as they move around the facility. Everybody is on the alert right now, because as we can see, the numbers are jumping. We've gone from 566 yesterday to 636 infected cases. So, I mean, we can see that there's the beginning of an explosion on hand, and we have to be, gear ourselves for this. So, regardless of the fact that expenditure for us has gone up, we've had to take the necessary steps to protect ourselves and to protect our staff, and even protect our patients who are coming in, because there are people who will come in who are not COVID positive. So you've got to make sure that you don't expose them to anyone who's a potential COVID case. So everybody is on the high alert right now. And as usual, we are screaming about PPE. But like I was saying earlier, talking to our colleagues in the public sector too, we realize that they even don't have PPE. So government really has to do something about it.
And that's exactly what you've done. We'll get more personal at the end of our conversation, but to hit the substantive matter, that you issued a statement in which you, the private medical and dental practitioners, are calling for government to provide those PPEs. You seem to suggest that members or people within the private sector providing health care have been sidelined. To what extent is this true?
Oh, after that, dear. I mean, up till now, we haven't really received any support whatsoever from government in terms of getting ourselves ready to combat this virulent virus that's out there. And we would have expected that at least they would have stretched their arms towards us. Yes, we've met with them. The promises have been made, but so far there's nothing that's forthcoming.
Okay, so some promise has been made. What exactly is in that promise?
Oh, well, they said they were going to provide us with PPEs. I mean, in our meeting with them, they listened to our grievances, but we tabled our grievances. And, you know, they talked about, we talked to them about risk allowance, we talked to them about utilities, water, and that kind of thing. And they said they would send help. I mean, we can't say they haven't done anything because, I mean, we can see from what's happening that they've agreed to provide free water for members of the citizenry for 3 months, free water, which is very, very important because everybody needs to wash their hands. So in communities where they buy water, I mean, honestly, those put us all at risk if they don't have water to wash their hands. So, well, we thank them that they've done that. What do you call it? There was a talk about tax rebates. I pointed out last week when I was talking to one of the channels that reading through what the health minister had said he was going to do, it had been specifically for workers in the Ministry of Health, MOH, was 130,345. And obviously the private sector was not included. But sometime last week, I think after that message went out, they actually asked us to submit lists of our staff to GRA. So I guess HEPA actually. So I guess they hopefully will take care of us. But apart from that, they really need to stretch their hands and get a little more involved in what's going on.
And the good thing, Doc, is that, like you said, you've been made some promises. I mean, some things have been told you, and you are expecting that. The good thing, I should say again, is that on this particular segment, we focus on frontline people like yourself, and so we'll definitely come back to you to follow up on what has become of it. But there was a meeting with governments where, you know, after the government announced intervention, you know, tax rebate, etc., for frontline health workers, has there been clarity as to whether or not you are a part of it, or that's what you refer to when you say you've submitted names? Okay,
they asked us to submit a list from HEFA, but I mean, nothing else has been said to us. So as to whether that will materialize or not, we don't know. So we're just hoping and trusting that they will do something about it. But it is absolutely important that they get us some PPE. And I'm talking about simple things like face masks. Face masks used to cost 10 to 12 cedis for 50 pieces. Right now, a box of face masks is between 300 and 350 Ghana cedis. Now, every staff member here has to be in a face mask because you don't know who they are talking to. We cannot put them at risk. So we have to provide these face masks at these astronomical prices. And N95, which doctors are wearing, you know, to actually do procedures and when you're in close contact with a positive case, they are costing 30 Ghana cedis a piece. It's absolutely ridiculous. And we are having to foot the entire bill of this. Expenditure, electricity is gone up, our water bills have gone up. We need some support, we need some assistance from government.
But the electricity and water, President Akufo-Addo indicated that there is some sort of free usage of those utilities for persons within certain sectors, and I believe that the health sector was a part of that.
We would like that reassurance. At least it would be good for us to hear from them, you know, clarity that this includes proprietors of private medical facilities across the country. If that clarity comes across, then we will take a deep breath as well.
Okay, so to what extent has the association itself, for example, gone forward asking these questions? Have your other executives, you know, been in touch with any of the authorities to give you these answers?
I think our Ashanti region group actually had a meeting as well, and they were made some promises as well. But this morning I was checking, and still there's nothing that's forthcoming. They were made some promises, but still they haven't been able to you know, fulfill those promises to them. So it's like, yes, the goodwill is there, but the thing is that the reality of the fact is that the patients are beginning to roll in. So it's good to have a promise, But at the end of the day, this is a virulent virus which, if any of us are, careless, we will end up contracting the virus ourselves. And as frontliners, they are coming to us, whether we like it or not. They are coming in day after day. So it's important for us to get the assistance we are requesting for, so that we will live to take care of, the society at large. But if at the end of the day, right at the beginning of this, we contract the virus, who's going to be there to take care of you? As of last week, there were about 14 doctors who were under quarantine. I don't know how many, I haven't checked this week. But already our colleagues are going into quarantine. Last week we lost an eminent doctor, professor of medicine. And I mean, it's scaring everybody. The junior colleagues are scared. I mean, you're on the platform, and from their comments, you can see that slowly they, even as health personnel, are beginning to get scared. When you have the PPE, then you know you have the right things to combat the problem, then at least you are confident when you are facing a patient. But if you know that, talking to this person or examining this person, I could contract this virus and put my own life at risk, honestly, it's a bit difficult. I mean, I think the government should please help us. The cry has, we've sent letters around, and we're still waiting. We're still waiting to help.
Right.
And so far, you find that companies are donating PPE to government. They are not giving it. Initially, I asked for a letter to take to USAID, but I found out that USAID donated. A colleague told me, a friend, my daughter's friend was, so I was told that they had PPE. But by the time it got to them, they had donated to government. Okay?
So the donations are going to government, and you're not
are going to
government. You're not getting the PPEs, right?
It needs to filter down to us.
Okay. This is certainly not the last time we'll be talking about this. We'll keep drumming this matter until the right authorities hear and respond. But we'll certainly also be trying working the lines with the health ministry to find out what answers we can get from there, as your members also, go all the way out to get those answers also from the authorities. But I indicated that we'll wrap up this conversation with get more personal. I spoke to a nurse. Our head of health desk spoke to a nurse who said, when you get home, the first thing you do is to leave, say, your shoes outside, and try as much as possible not to get close to your family, your spouse, your children. You want to take a shower before you do all of that. Do you want to share your own personal story since COVID-19? Hello, Doug?
I said that's absolutely necessary, because you don't want to carry infection from the workplace.
So what do you do? I'm just trying to get very personal so people can feel the reason why they need to stay at home, so that we all are protected. What's your personal story?
Okay, so when I get home, I change my shoes. Okay. So like she's saying, the shoes I'm using within the hospital don't enter my house.
Right.
And I have a Veronica bucket outside. So as soon as I get out of the car, I'm washing my hands. The other thing is the use of sanitizer, because, even your door handles, the door handles to your car, you're sitting out here, the car is sitting outside. You have patients coming in. It's possible somebody can touch your car and their hands are contaminated. So you need to be even wiping your handles, the door handles of your car, with sanitizer. So you use sanitizer as often as you can. And when you get home, you want to take a bath. So you want to take off your clothes almost immediately and jump under the shower to take a shower. So that's, I think all of us are probably doing that, because you've got to be careful. I mean, even for our own personal sake, you have to make sure that you've washed off. And it's soap and water. Soap and water destroys the outer coating of the virus. So it's important to take that bath. It's important. And then the other thing that some of us forget is we wear jewelry. So you've got to also be careful about the jewelry. I tend to, sometimes I lapse on that. So, but you see, the thing about it is, even for us professionals, with all the knowledge that we have, they're talking about social distancing. It's not easy to social distance.
Yeah.
So there are times that you find yourself and you're talking to another colleague that makes you you shake hands and you realize, oh, no, I'm not supposed to be doing that. Then you stretch for the sanitizer. So if even with us, the people with all the knowledge, we find ourselves making slips and making mistakes, then you understand why government is asking people to stay at home.
Yeah.
Because you can decide that, look, I'm going out and I will social distance, but some way, somehow, you will slip. And God save you if whoever you are talking to has COVID. Sometimes we look at the people who've gone to the beach. There was something on social media with people on the beach yesterday. I almost had a heart attack. And then look at the market. People are still going to the market. I think that we should make it mandatory for people to wear masks. Reason being that, you know, I talked to somebody, a literate person in Fete yesterday, and he was telling me that, oh, he's around the beach, so he doesn't believe that he can catch COVID. I was so shocked. I just said to him that, look, don't be silly. Don't be silly. I went into Choco. I have an elderly patient. He's about 92. And in Choco, he's an opinion leader of the Ghana. So I went there to see him. And he has all these people coming into his house. So I told him that, look, you can't entertain anybody in your house anymore. And there was a Ghana leader there. And I was explaining to him about COVID and how it is a droplet infection and how they can contract it. And he said, then he looks at me and says, oh, we can't get it. We are immune to COVID. And I thought, oh my God, if you people,
the opinion leaders, they are.
Yes. Don't believe that you can contract it, then what are we doing?
Yeah, so I can get the frustration in your voice, but don't get a heart attack, Kate. We need people like you to take care of us at the moment, and we also want to be there. If we
make it mandatory for people to wear masks, they will ask, why are we wearing masks? Education needs to go out there. People need to understand what we are talking. They haven't got it. They haven't understood what we are talking about. And I will beg government to use the machinery in place to spread it to the least in society that, you know, this thing is real. A lot of people think it's not real. People don't watch CNN. People don't watch Al Jazeera and see what's going on in Italy
in other countries. Well, one of the things we're hoping to do today is to play for them what's happening in Ecuador, where they don't even have places to bury the dead. They don't have, people are keeping their dead in their living rooms and sleeping outside because even the graveyards are overwhelmed. We'll bring that story. But Doc, thank you so much. We'll come back to you, I'm sure, perhaps next week to find out what has changed, you know, as far as this story is concerned, whether you've had clarity on all of the issues that you've raised. Thank you so much for joining us here.
Thank you very much.
I've been talking to, she's a doctor. She's the secretary, national secretary of the Private Medical and Dental Practitioners, Dr. Aramansa Forjoe. She's a national secretary. You heard what she said there. She believes that it's about time we make wearing of masks mandatory, especially if you're going out there. It's certainly something that we'll keep talking about. This has been The Frontline, where we celebrate all our frontline workers.